Hello everyone. My name is Daman. She's my wife, Harpreet. We've just delivered, or rather, doctor has delivered baby. We've named him Teghveer Singh. I think it's been a very overwhelming journey. Last
Yeah.
3 months have been full of anticipation and there's been a plethora of emotions that we've gone through. Dr. Pooja Kiran and the entire staff has been around. Uh, when The constant support, the love that we've received so far has been absolutely tremendous. Baby is doing absolutely fine. We are so thankful and so grateful.
Yeah, no, a special thanks to Dr. Pooja. When we were in Bangalore, we thought I was very scared to come here, and I was very scared कि कैसे doctor मिलेंगे and to find the right doctor, but I can't ask for more. So thank you so much, Dr. Pooja and Dr. Yasir. Thank you so much. I remember that time when you came in and you gave epidural. It was like life-changing moment, I'd say. So thank you so much, and thank you to all the staff for your cooperation. Thank you so much.
We had a patient by name Harpreet. And she came with me at the seventh month of amenorrhea, and then she asked me one question very clearly about that painless delivery. So we had a delivery. She came with a normal spontaneous delivery. Then we decided to go for an epidural analgesia, and then she went with a very smooth painless delivery, which is birth weight of the baby was 3.8 kg. Now the baby and mother was good thanks to the anesthesia team, Dr. Yasir sir. Sir, thank you so much.
Thank you.
For giving me the very smooth delivery of the patient, and for me also tensionless. Yes, we will do the painless delivery nowadays, and it's the most common thing. And that too, she was a primary gravida. It's the first delivery with such a big baby birth weight. So we want to continue this by our team as a gynecologist and the anesthetist to go ahead for further, for all the ladies to will prefer the painless delivery.
So already Dr. Pooja has talked about a patient who underwent a painless delivery. She had a very smooth delivery, and the baby outcome was absolutely normal. So I will give a brief talk about labor analgesia. Labor analgesia it's a method of relieving pain during childbirth without keeping the mother awake, so that she can participate in the birthing process. It is broadly divided into two categories: non-pharmacological and pharmacological. Non-pharmacological methods include making the patient, firstly giving a psychological support to the patient, giving her different kinds of exercises, and physical methods like massage and water baths. So it's categorized into again two subtypes: systemic and regional. Systemic we can give in the form of systemic opioids like fentanyl, sufentanil and pethidine, but they are a little bit they have side effects to the baby as well as to the mother. We all know what are the side effects of systemic opioids, like nausea, vomiting, pruritus and constipation. And then they can have the fetus can have respiratory depression after childbirth. So it's less preferable, although it can be used, but less preferable. And the second one includes is the mixture of giving a mixture of 50% oxygen and 50% nitrous. It's also, although useful, but it's less effective in advanced stages of labor. So the gold standard nowadays is regional anesthesia, and among the regional anesthesia, the gold standard is epidural analgesia. Epidural analgesia, we put a catheter or inside the epidural space and give very low doses of low concentrations of local anesthetics with additives like opioids, which include fentanyl and sufentanil in very small doses. And then we can give the top-up doses in the later stages of the labor, so that the patient remains, from beginning to the end of the labor, the patient feels no pain during childbirth. And Another method is giving a single shot spinal analgesia with a low dose of local anesthetic, as well as although it's very rapid, but it is of short duration. We usually use it in the later stages, on the third stage of the labor, to relieve the pain. So I recommend, if there is a good indication for normal delivery, apart from if there is an absolute indication for cesarean, I will not recommend that. But if a patient is motivated in the early stages of his pregnancy, of her pregnancy, we can definitely have a very good outcome of pregnancy in the form of painless and smooth childbirth vaginally. Add more and more patients and counsel them beforehand for labor analgesia, so that we can increase the percentage and increase the chances of normal vaginal delivery through painless methods. Thank you.